I'd like to talk to you today about how important it is to make the choice of being an organ donor. By becoming an organ donor, you can be able to say, I will save a life. Organ donation is a selfless way of giving back to others and to be able to make a huge difference by giving another person a second chance at life. Unfortunately, the number of patients waiting for organs far exceeds the number of people who have registered to become organ donors. Patients are forced to wait months, even years, for a match, and far too many die before they are provided with a suitable organ. There are many stigmas related to organ donation, but most of them are relatively false. And in order to be well informed, you must know what organ donation is, how it works, and how to become an organ donor, what organs and tissues you can donate. Becoming an organ donor after death is not only an important decision for yourself, but it is also an important decision for the life that you may have the power to save. Organ donation takes healthy organs and tissues from one person for transplantation into another. Organs you can donate include kidneys, heart, liver, pancreas, intestines, lungs, skin, bone marrow, and cornea. That's the front part of the eye. Organ donations usually occur for patients with kidney failure, heart disease, lung disease, and cirrhosis of the liver. For patients who need a kidney or liver, a living donor's organ can be utilized since we already are born with an extra kidney and the liver can regenerate itself. However, if the patient needs a heart, a lung, pancreas, or cornea, the organ needs to come from a deceased donor. A transplant is usually the last course of action in the treatment of a patient, but if the patient is willing and able, it can be a good option. If the patient consents to the organ transplant, doctors put the patient's name on a list by the United Network for Organ Sharing, or UNOS. Acceptable donors are those who are brain dead but are still on life support. They technically are dead, but the body is still functioning, so the organs remain healthy. A match is when both the donor and the recipient have the same blood and tissue type, and other medical factors are considered depending on the specific needs for each case. Also, how long a patient has been waiting for an organ is a big factor when choosing who will get which organ. Um, some people may have the wrong idea about donation, and there are several myths about donation I'd like to set straight. If I agree to donate my organs, the hospital won't work as hard to save my life. When you go to the hospital for treatment, doctors focus on saving your life, not someone else's. And the doctors in charge of your care, the doctor that's in charge of your care has nothing to do with the transplant. Organ donation is against my religion. Organ donation is constant with our beliefs and religions, including Catholicism, Protestants, Islam, and most branches of Judaism. If you are unsure of your faith's position on the subject, you can check organdonor.gov, which has a list of many religious views on organ donation. Another myth is an open casket funeral isn't an option for organ donors. The donor's body is fully clothed, so no one will see any markings or scars from the donation. Skin is taken from the donor's back and thighs, so that's nothing that's going to be a problem. I'm too old for donation. That's another myth. There's no defined cutoff age for donating organs, and there have been many successful organ donations from donors in their 70s and 80s. The decision to use the organs is based on medical criteria and not necessarily on age. Another myth is maybe I won't really be dead when they sign the death certificate. People who are organ donors are actually given more tests to determine that the patient is truly dead than they would give those that are not organ donors. Now I'd like to explain how to become an organ donor and the benefits of organ donation. First of all, people of all ages and backgrounds can be organ donors, even if you're under 18, but you must have permission from your parents before you register as a donor. Register with your state donor registry by going to organdonor.gov and registering online according to what state you live in. All you have to do is enter in some basic information such as your name, your address, height, gender, and race, and also what specific organs you're willing to donate. Designate your decision on your driver's license as well whenever you renew it. You can sign a donor card and carry the card with you. Talk to your family about your donation decision and help them understand your reason for this wish. Some benefits that come along with organ donation is the satisfaction of being able to save lives even when you're gone. And some families feel knowing that their loved one has helped save a life, they feel a whole lot better, and it helps them cope with their loss. I've been registered as an organ donor and never really realized how much of a need there was in the U.S. and around the world. However, now that I'm more informed on the subject, it seems like a no-brainer to just register to donate my organs. If you really think about it, are you going to be using your organs in the grave when you die? The answer is obviously no. So why would you not help save someone else by giving them something that you're no longer going to need? So many patients who are in need of a new organ just want a second chance at life, and it's so easy to help them. It amazes me, as of November 26, 2010, there were 9,729 registered organ donors, and as of yesterday, 109,966 are on the waiting list candidates for organ transplants. Please help me change these numbers by registering to become an organ donor, and together we will be satisfied knowing that we will, in the future, save someone else's life.